Hello, I am Dr. Ambar Konar, consultant rehabilitation physician, Rehabana, Salt Lake, Kolkata. We often get a question from patients or relatives that what are the conditions we do treat at neurorehabilitation center or center-based neurorehabilitation. There are n numbers of conditions in which patients are neurologically affected. They can be well treated with neurorehabilitation. The conditions are so many in number that we cannot enumerate them all together. So I thought the idea of putting this video that today itself we are treating around 28 patients. Almost everyone has different diagnosis. So if we can tell the diagnosis, the patients, the number of patients are being treated today, you will get an idea how diverse the neurological conditions that can be well helped with neurorehabilitation might be. So we are treating the conditions like hereditary sensorimotor neuropathy, multiple myeloma with compressive myelopathy, one patient with stroke with speech problem, one patient with cerebral hemorrhage, overlapping ischemic stroke, and one patient coming with CNS lymphoma presented with quadriparesis, and one patient came with whiplash injury. Another patient is suffering from cardioembolic stroke, and one patient suffering from stroke due to thalamopedunculaire hemorrhage. There is a patient with hemorrhagic stroke and gait disturbances. Along with there are patients with cervical spinal cord injury and anterior cord compression, idiopathic Parkinson syndrome with hand problems, and traumatic brain injury with extradural hemorrhage. There is a female lady coming with spinocerebellar ataxia, and one male patient came with ischemic stroke in MCA territory. There is a kid with spastic quadriparesis due to encephalopathy. There is a patient with right basal ganglia hemorrhage. There are patients with single patient with spondylolisthesis with central canal stenosis. There is also patient coming today itself with left hemiparesis due to basilar artery stenosis and pontine infarct. There is a patient with idiopathic Parkinson's disease with gait disturbances. There is a kid with hypoxic ischemic encephalopathy along with convulsion disorder. One elderly lady with idiopathic transverse myelitis is attending today's session. One male patient is attending with OPLL, ossified posterior longitudinal ligament with cervical myelopathy. There is an elderly person coming with stroke with spasticity. There are four more patients. One is failed back surgery syndrome, another young lady with neuromyelitis optica, and one elderly person with Koda-Equina syndrome, and one patient with central cord syndrome due to whiplash injury. So these are the 28 patients who itself came only for today, and so many diagnoses, but the treatment is neurorehabilitation. Of course, it is to be customized for everyone separately. Some need more focus on medication, some need more focus on gait training, some need focus on occupational therapy, some need physical therapy, some need robotic rehabilitation, most of them require balance training with gait training. So these all are the conditions that can be well treated with neurorehabilitation. Thank you.